Also today, the Health Minister confirmed that Australians will get access to vaccines a little earlier than planned in the first weeks of March. But of course, calls for an earlier rollout continue unabated. To discuss that and the other various vaccines and therapies in the melting pot at the moment, I've got Dr. Paul Griffin, the Director of Infectious Diseases at Mater Health, with us right now. Dr. Griffin, thank you very much for your time.
Thanks for having me.
So it's early March now, we're hearing. Is there any real rush to roll this out, say, next month?
Look, I think just like we've done with all the clinical trials for these vaccines, we need to make sure due process is followed. So we're absolutely sure it's the right thing to do to use these vaccines, and they're as safe and as effective as they look like they are. And we obviously need to apply our own regulatory processes here in this country to make sure that the data generated overseas applies to our population in our context. And so we certainly don't want to rush it. And while obviously we've got a situation in this country that needs some mitigation strategies to try and address, we're nothing like most of the rest of the world. So in reality, I think it's important that we follow those processes and we don't rush this part.
And of course, learn from the period that we have millions taking the vaccine in both the UK and the United States. We can learn a lot from that because millions have not taken the vaccine up until now.
Yeah, that's exactly right. And, basically every day we're getting more and more data and understanding more and more, not only about the virus, but also the vaccine. So, every additional day that's taken to make sure this is the right thing to do and that our regulatory process is applied is a plus. So, I think we need to do it as quickly as possible, but without compromising on any of our usual checks and balances. And that's what I understand is happening.
Now, explain to me this. You're running, personally, trials on the Novavax vaccine, in fact, 4 vaccines. Explain to us what chance these have of making the cut.
Look, it's always hard to know at the outset. So I'm probably running phase 1 trials for the first time these vaccines are given to people. And, traditionally drugs and therapies and vaccines, only around 10% that make it to human trials will get all the way through. And, we've unfortunately seen some vaccines that look really promising not be able to progress. And, obviously that demonstrates the strength of our clinical trial process and why we have all these different phases. So, the ones I'm working on now all look really good. And if they didn't, we wouldn't be doing these clinical trials. But we need to make sure we follow the process that we always do, progress through these clinical trials, and when we have the data to support their use, then we'll recommend they be used.
Yeah, and then therapies. You're working on 2 therapies. We're underestimating the power of therapies. We keep talking about the vaccine, but therapies are crucial, aren't they?
Look, that's exactly right. The vaccine is obviously going to be a key part of our strategy, but it's not going to be a silver bullet that makes this all go away overnight. So we're going to need vaccines, and we're probably going to need vaccines to follow this first round of vaccines, but we're also going to need therapies so that when people do catch the illness and start to deteriorate, that we have ways of reducing their severity or perhaps duration. And, one promising therapy we're seeing is antibody therapy, where instead of people making antibodies from a vaccine to stop them getting infected, is after they're infected, we can actually give them antibodies that are produced in a laboratory to hopefully, again, reduce the severity and duration of the illness. And, we're going to continue to need therapies to help with the vaccines to reduce the impact of this virus moving forward, definitely.
See, the way you're talking in reference to vaccines and therapies indicates to me that you see this pandemic going a lot longer than the next 8 or 9 months. And a lot of leaders around Australia don't get it, that we've got to start living with clusters of 15 in Barella, with 100 from the northern beaches. These will crop up continually, won't they?
Look, absolutely. And I certainly don't want to give the impression that the vaccine is not going to be a huge part of our solution. And, obviously how well that works is going to be very much dependent on how many people get the vaccine. So I'd certainly encourage people to do that. But, you're right. This is going to continue for some time. And, we're going to need mitigation strategies that are bearable and that we can live with, that are sufficient to control the spread of the virus, but that obviously don't have an excessive impact. And, for example, I think border restrictions at the moment with our epidemiology in this country and our contact tracing and our testing capabilities should really be the focus. And maybe, as I say, then if we're doing those more specific interventions right, we can relax those border restrictions and hopefully get back to some freedoms that I think people need to be able to tolerate what the next few months are going to look like.
Oh, hear. Great to hear from you. One quick one. The SCG crowd tomorrow will be wearing masks while seated. You'd be happy with that safer, sensible approach?
Look, absolutely. I think we need to be able to hold some of these events, again, to give people something to look forward to and something to do, but, obviously apply all the relevant mitigation strategies. And, again, this is the reality moving forward. Social distancing is going to be a key. Hand hygiene, we can't say that enough. And when you can't social distance, so, for example, you're on the way to an event or at an event, then a mask is a really good strategy of protecting yourself as well as those people around you. And obviously the other thing is, if you're not feeling well, if you've got some symptoms and maybe you've been waiting a long time to get to an event like this, you have to do the right thing and get tested and stay home till you get your result. And if we do those things, then we'll be able to hold more events like this in a safe way.
Dr. Paul Griffin, thank you very much for your time.
Pleasure. Thank you.
Great stuff.